The cost of IT in business can be staggering. From hardware and software expenses to services like internet and phone, you don't need to spend a fortune on IT to succeed. If your organization spends more than $500 monthly on any service, or you're considering signing a long-term contract, IT Enabled can help you manage your technology and minimize your costs. Contact us today to schedule a free consultation. IT Enabled, we're here to help.
Hi, I'm Tara Watson-Watkins, President and CEO of the Lufkin, Angelina County Chamber of Commerce. Welcome to the Connect podcast, connecting business to the community. I'm here today with my co-host, Blake Pollino of BP Media Group.
So this week on the podcast, we have Demetress Harrell of Hospice in the Pines here to talk about this awesome organization, everything that she's done. She's been there for 29 years, shares her experience, and even a little bit of life advice along the way. So let's get into that episode now.
Well, we're so excited to have Demetress Harrell with us today with Hospice in the Pines. I can't believe this is your first time on the podcast.
It is.
Well, we're excited to have you. Why don't you start by telling the listeners a little bit about yourself, your background, and then we'll get into what Hospice in the Pines does.
Okay. Demetress Harrell, and I have had the pleasure of being in and a part of this community for a little over 35 years. I have a background in education, also healthcare, social work degree, and I have really been impacted by the community's commitment to nonprofits, and I love doing the work that we do at Hospice in the Pines, where I just recently celebrated 29 years.
That's fantastic.
29 years.
I know.
Wow, that's incredible.
That's amazing. It's amazing. Well, so let's talk about Hospice in the Pines. You're the only not-for-profit hospice in Angelina County.
Absolutely. We began our organization in 1986, and we still remain the only not-for-profit to serve Angelina County and more than 11 additional counties.
Wow.
Yes.
So I'm afraid people may not know what hospice does until it's impacted their life. So tell people, kind of explain how that process works and a little bit about that.
You know, absolutely. And I really would say that I try to support every individual in wherever they are in the stage of their determination of what would be best for their end-of-life care. And hospice is designed as an end-of-life care provider from a holistic approach. We provide all elements of discipline, from their psychological, psychosocial, medical, clinical, their mental care. All of those things are provided through one institution. Our hospice, being a not-for-profit, regardless of a person's ability to pay, they receive care. And that,
Great.
To me, has been a tremendous commitment and where I'm most passionate that every single person would receive care. And when a person decides, one, that they are ready for hospice, they have to have a admitting diagnosis that says that they have a limited life expectancy. That can be a malignant diagnosis or a non-malignant. And we see a lot of heart disease, a lot of Alzheimer's, dementia. So that is when a person would then be referred to our organization. Mm-hmm. And we would have our clinical team go out and do a full physical assessment to determine where they are in their disease process.
And how long is that process normally? So when they come to you for end-of-life care, how long of a term is that usually?
You know, unfortunately, we are seeing a very short length of stay, and that is because it's hard. It's a very difficult decision for anyone to make, but we would love to get patients on sooner. And over my 29-year tenure, in the beginning, we were getting patients that were living for more than a year. One, because once they get on care, they have the cohesive care and collaboration of a full team. Mm-hmm. And we have, and research determines that hospice allows people to have a longer life when gotten early, when they receive it earlier. And so that is one of the bigger challenges, is to allow and help families make those decisions. And most of our patients, and Tara knows this because she is one of our board of directors, once they make the decision to come on hospice, they always say, I wish I would have known about this sooner.
It's so underutilized. I
Yeah.
mean, that's the thing we see over and over and over.
Yes.
And that statement, how many times, I know that y'all hear it all the time. I hear it all the time as a board member, but having utilized hospice now multiple times, the first time I ever really remember Demetress was, I was a teenager, and my grandfather was put on care with Hospice in the Pines, and y'all helped my grandparents for over a year off and on. And it just took the burden off of my grandmother, which was so helpful, that she didn't have to do all the bathing, and she didn't have to do all the medication. And even though she was a nurse, they were in their 80s, and it really took the pressure off of my mom and my grandmother. And then we used it again with my father-in-law. But yeah, if people could just understand that it's not just a death sentence, that it truly is to help the family and to help the patient live longer and live more comfortably.
Yeah, that's great. I think it can be a misconception when people think of hospice. They think it's just that very, very, very short end of life, but it can be for a good amount of time.
Yes,
that's
absolutely.
great. So your 29 years that you've been there, what would you say has been your greatest achievement in the work that you've done there?
The first thing when thinking about achievement, it is that I have been able to provide that level quality of care to a vast amount of people. And they have called me directly to receive that counseling, that support. And so I would say that one, as a servant, that I've been able to be a part of this wonderful organization for that length of time. Number two, to see that we have accomplished so many things. We've received a multitude of accolades for the quality of care that we've provided, from patient satisfaction to state awards. And that gives you great satisfaction to know that your team is able to provide the kind of care that this community deserves. I would say that is a true accomplishment.
Yeah.
That's great.
And not only are you winning state awards, but y'all are, you yourself are being recognized nationally. She serves on the Texas, New Mexico Hospice, and you're just doing such great work, and your team does such great work. None of us do the things by ourselves.
Right.
And your staff and your team are just phenomenal.
That's right.
That's great.
What gives you the most satisfaction about working for hospice? You've talked about being able to take care of people and the amount of people, but
I think that is the greatest satisfaction. One, I'm passionate about this industry, and I have had the opportunity year after year to go to the U.S. Capitol and advocate for this type of care, that we, one, get our fair share of reimbursement. Number two, that the patients continue to be able to have access. And that is what is necessary, is that people of all demographics, regardless of their ability to pay, have access to this type of care. And that is true satisfaction. When I can see that a family who has no way to determine where to go, and they are led and they are guided, and the team is able to reduce the pain, eliminate the distress, and the family walks away saying, man, I feel really good now about the decision that we've made for our loved one.
That's great. What's the alternative if you're not there? Are these people just having to try to take off work and care for these loved ones? And how would they go about doing that if you weren't providing this?
What I see every single day, and I was on the phone last night with a dear friend, they really feel like they don't have answers. They are in a world where they are trying to meet every obligation to support that loved one. And I think one of the hardest things for us as individuals is we want to do what the loved one says they need.
Right.
But it comes a time in which we, the ones who are left behind, have to decide what is going to make us most comfortable and eliminate that guilt and have satisfaction in making that decision. So the ultimate result is a patient that oftentimes has an immense amount of pain. The family is tired and they have anxiety. And sometimes when we get to that level, we don't care for the loved one in the way that we can and should. There sometimes is anger, frustration, therefore the lack of support. for all parties involved. And so many times people are just left without that support and that assistance. And I think that that's probably one of the greatest values of hospice is that we provide more than 13 months of bereavement care after the loved one has died.
That's great.
And people wouldn't have that otherwise.
Yeah.
Not only do you do the bereavement care for adults, but you also have a wonderful program for the kids in the summer. Let's talk about that.
Yes, our children's grief camp. Many years ago, I realized that I wanted to make sure that we help every person involved. And a lot of times we think, well, it was my father, it was my mother, but it was also a child's grandparent. And grandparents have a huge part in the lives of children. And mine definitely did, and Tara's as well. And so our children's grief camp is a week-long camp where children come and they are able to express how they feel about death. And death is one of those things we don't like to talk about. It's not what we wake up and make those decisions, but it's amazing that children speak openly and they speak free and they are able to have fun. They have fellowship. They have lots of activities. And all of these things are centered around the loss of a loved one at their age. I wrote a book some years ago, and it actually breaks down how a child conceptualized death based on age. And so we talk about those things and we give them these types of activities. We bring in specialists. We have counselors. They have supervision. The parents feel that it is a safe place. And oftentimes the parents will come back or their guardian and say, they never had opened up and shared those things with me. But in camp, it has made things so much better. Because most of the times when a child is mourning, they act out. They exhibit those types of behaviors that no one knows how to address. But this camp does just that.
That's awesome.
It's an amazing program.
Yeah.
Yes.
So is that something that you're doing annually? If
We do it
interested in
annually, and it is named after a young woman that we took care of, a young girl here in our community, Lizzie Wallace. They can contact us directly. We always have it in the month of June. We give children the opportunity to get out of school. We contact all of the counselors in our local school districts, and we encourage them to get the child signed up. We leave those packets with them to give to their their families, their parents, as well as any guardians that may be overseeing the children.
Yeah,
it's been wonderful.
A great camp.
It's
That's
been
great.
a wonderful
That's awesome.
support.
So I know you've done some programs lately with Hospice in the Pines. What are some of the things that you've developed recently?
Yes, one of the greatest rewards, and I was on a call yesterday with the state organization, but we have a palliative care program. And oftentimes people say, what is the difference in hospice and palliative care? Because for years, those have been seen as the same. It is palliative care when we are providing hospice care. But this new program allows a patient who is still looking to seek aggressive treatment like chemotherapy or radiation to come on services. They still have a terminal diagnosis. They have a life-limited illness, but they are wanting to see more treatment. And it also demystifies that term hospice that people are so fearful of. Because as you said moments ago, it appears that it is a death sentence. But once they get on, they realize. So this is an easier way for them to transition to hospice. And most of our patients that come on the palliative care program, they do transition to hospice later. It has been wonderful. So that program addresses, one, any symptoms that they have that they're not able to have someone in the home to assist with. They can also still have home health. They can still have all of the medical treatment with their physicians and other alliances. And they then still have our nurse, our social workers to come in and assist with that. It has been wonderful.
That's great.
And we have a wonderful nurse, Crystal Galloway, who leads that program.
That's awesome.
That's great.
So it's an interesting career field to be in. Did you ever imagine yourself getting into that, or is it something you always thought you would be doing?
I really thought I was going to be a high school counselor. That was what I wanted to do. That's what I thought I should. And it was when my husband picked up the paper and saw an ad for a job in a nursing home. And I went and interviewed as a social worker. And I got in there and I just fell in love with senior care. Then, of course, I continued my studies and became certified as a nursing home administrator and realized that I would have to relocate. And a local hospice by the name of Hospice in the Pines, we were Hospice of Lufkin initially. They were coming in because they had a contract with our nursing home facility. And they continued to say, you should come work for us. At the moment of hearing that, I thought, people are dying. I want to be about life. But I realized hospice is about life. It is allowing patients to have the script to write their destiny. How do you want to die? And you want to die with dignity, you want to die with pride, and you want to die with comfort. And that is what I transitioned to in my career, and I love what I do. I love touching the lives of people every single day and ensuring that we are empowering one another as hospice team members.
Well, you definitely do that.
Yeah, that's awesome. Is it a hard industry to work in? I remember, so my mom was a nurse growing up, and she didn't work in hospice, but she worked in like a critical care, and the percentage of her patients that would go home was very, very low. And so is that difficult mentally? How does that work?
It is. Definitely when we are taking care of someone we know personally. And I go by our inpatient. We are the only hospice to serve in Lufkin and Angelina County that has a freestanding inpatient facility. So that has more acute care and those who have more serious needs and concerns. But it is. And every single time a family ask, or even friends, what do you do for a living? I say hospice. They say, oh my God, it takes special people to do that. You all are angels. We could never imagine doing that. Thank you for what you do. It is a hard industry because we get attached. We fall in love with our patients and what we do. We have 2 nurse aides, Evie Young and Debbie Metlin, who has been with our, they are the best. They've been with our organization more than 29 years. And it is that type of love that we see in them. Evie, people have said she's the Ebonizer because she does all of their activities of daily living. But that's what, to me, makes me drive in every single day with the robust energy to say, we're doing this again. And that's what people see. That's what we need. We need people that are dedicated to this type of industry because not everyone can do it.
Yeah. The thing I see about y'all is, I don't know when you sleep because you're at the office literally 20 out of 24 hours. And your whole team is that way. You're always there when needed, whether it's at the hospital or whether it's at the office. Whether it's like the other day, I emailed you and then I texted you and I said, hey, did you get my email? And you were like, I have 500 and something emails that came through last night.
That's right.
And I'm like, well, here's what I sent you. But, I think that says so much about you being a hospice ambassador, not only for here locally, but also the National Hospice and Palliative Care Organizations. But I really don't know when y'all sleep because you're there all the time. You're always with the families and the patients and taking care of them.
Yes. A lot of people don't realize this with hospice, and I think this makes a tremendous difference, is that we are available 365 days, 24 hours a day. Our nurses are on call, our social workers are on call, administrators are on call. So at any time, and we see a lot of patients that pass away at 2 a.m., they die at 7 a.m., 12 midnight, and we are available. We go out and we pronounce every single patient. We do postmortem care. And, a lot of people would say, man, you all do all of that. I've done postmortem care. I think that it is very special when families say, I want to come in and help you prepare mother before she goes to the funeral home.
Sure.
We are the ones who contact the funeral home. We make sure that the family has had plenty of time to be with their loved one after the passing, after they die. And then, of course, we provide immediate bereavement support. The moment that person dies, our chaplains are there and available. We provide, Hospice in the Pines provides all medication that is directly related to their terminal condition. So at the time of death, we actually go through all of the medication and we destroy it on site. Number two, we provide all medical equipment. All of these things are provided with all under the hospice care certification. And so they get hospital beds, wheelchairs, bedside commode, oxygen, anything they need. And those things are also picked up at time of death. We contact our equipment company and get them out as soon as possible. So we try to facilitate for the family those things that they really don't have time or are not emotionally prepared to do. And that's wonderful.
They do everything. Let's just say that.
That's amazing. That's awesome. So I read a book from somebody, his name escapes me, but he had worked in end-of-life care for 50 plus years.
Yes.
So he had a really unique experience seeing a lot of people at end of life, as I'm sure that you do and your team do as well. Do you have any life advice for people that you could share, having seen so many families together, so many loved ones kind of at end of life? Do you have anything you could share with people?
It's going to be hard, what I am about to say, but I always say we need to do it now. At my age, a lot of people would say, well, why are you thinking and talking about death? But we all need to start preparing today. One, when I went to see my attorney and shared with him that I was ready to start my will and wanted to get all of those things in place, so that my husband would not have the difficulty of making the decision of what I wanted. I know Tara said one time she has all the pictures that she wants.
There is a file. Britt Watkins is not picking out the pictures to be shown at my funeral.
That's great.
I have all the good-looking photos on a file.
I need to tell Amber to put one of those together because if that happens, I do not need to be responsible for that.
Yes. But talking about death and dying is difficult.
Yes.
But we need to allow ourselves to make those decisions, because when we leave that up to our families, it is so hard. That is probably the most difficult thing that I talk to families every single day about, is them saying, well, I think this is what mom wants, or I think this is what dad wants, and they're not being certain, and they want to do the right thing. And so I've heard many of them say, oh, well, dad said he never wanted to die at home, or my loved one never wanted to die in the hospital. And so they're trying to determine, how do I take care of them at home? Because they said they wanted to die at home. And that not always is the most perfect place to die.
Right.
Especially if you're leaving young children, or you're living a senior in the home, and they have to look in that environment of where their loved one last laid.
Sure.
So I encourage people to talk about it first. I have written a very simple little document that actually has a place where people can list all of the things that they would like at time of death. So what do they want to desire in a funeral? Do they want it to be a traditional funeral? Do they want cremation? What are their favorite colors? Have they served in the military? What name would they like to go by? Because oftentimes those are the things that families are trying to determine, and it prolongs their grief, because even for the memorial ceremonies or funerals, they are trying to determine, what would mom want, or where do I locate those things?
The documents, that's right.
Yes.
You know, my mom has a book that I remember as a kid. It's called Answers, and it's a big notebook. And she has always said, when something happens to me, you need to go and just get that notebook. It has everything. It has every credit card written in it.
Oh, wow.
It has every bank account written in it. It is everything that I would ever need.
That's great.
As one of her kids to be able to go and to be able to do. And so, you know, I'm with you. Write it down, have it someplace, let people know where you've put it, you know. You better go grab my Bible, girl. It's got stuff written all in there.
That's right.
That's great.
That's so important.
It's so important. And for my father, as an only child, we had gone to see his attorney. He had everything written out. He had me as his power of attorney. We need to also understand what is active at time of death might not be something that you can utilize. A lot of people assume that a power of attorney will work after death. It is only during the time of life when the person is no longer able to make decisions for themselves based on how it is written. A will is after death. And so we have to have those documents, and we have to seek those professionals that can guide us, lead us in the direction that would be best for the entire family. Because unfortunately, death causes conflict and confusion, because a lot of times they have not shared what they want, and so there are those children that are left behind trying to determine, and then there's discord.
That's right. Well, you mentioned earlier that you're the only non-for-profit, but let's talk about charity care, because y'all do so much every year.
We do more than $250,000 in charity care. One, because we take care of every patient regardless of their ability to pay. They don't come on to hospice and pay anything directly to us. We utilize their Medicare, Medicaid, and private insurance. And so Medicare has a hospice benefit. It started in the early 80s and 1986. So in reality, those patients that come on our services, they don't pay anything above what Medicare is sharing with their liable. And so I always say that one, that is a wonderful service, because not every hospice provides that type of service, and even some nonprofits charge an additional fee. But for Hospice in the Pines, there is no out-of-pocket expense. So we pay for all the medications, all of the supplies, all of those things come under that umbrella. If a patient, and I always like to say I could be that individual, doesn't have Medicare because we're too young to receive that benefit, you have to be 65, then, of course, they don't have Medicaid. And so because they have a little too much income, they would fall victim to be considered an indigent or charitable patient. But we would still provide those services to them. And what they could pay for, they would, if they have medication that is outside of those things covered by our agency. But we would still provide all of their care for those individuals. And we are seeing a lot of younger people that don't qualify for those other benefits. If we lose our jobs, we oftentimes don't have private insurance either. So that's where that more than $250,000, and we've been tremendously blessed by solicited and unsolicited donations. We have a lot of memorial contributions and things like United Way that support our organization.
I love that.
Yeah.
That's so awesome.
Well, thank you for all that you do for our community and for the 11 counties that surround us that you also do work in. Thank you very much. It's been an honor to serve and to stand with you. And it's a phenomenal organization.
We say that we are a labor of love undertaken by our board of directors, staff, and volunteers. And that truly is the vision of Hospice in the Pines, that we take care of every patient that qualifies and meets that standard, and we support them. When integrity matters, choose Hospice in the Pines. You're going to always receive the best of care.
Awesome. Well, thank you so much for taking the time to come on the podcast. It's always so nice to talk to you. You're just one of the few people in the world I know who just has such a clear vision of what you're doing and the ability to communicate where like what you want to do and where you want to go. I always appreciate that about you. So thank you so much for coming on the podcast. We truly appreciate you. And please go check this organization out. Support them in any way that you can. And we want to thank you for listening to the podcast again this week. We truly appreciate your support. Please do us a favor and make sure that you're following or subscribe to the podcast wherever you're listening so that you get notifications every time we drop an episode each week. Thank you so much, and we'll see you next week.